Hello everyone, welcome to my channel. I'm here to teach you some pharmacology stuff. Let's move on to the introduction of pharmacology. What is pharmacology? In general, pharmacology is all about drugs. I here put an example of pharmacology that defined by Bertram J. Katzen, Basic and Clinical Pharmacology, 9th edition. I'm not going to talk about more about definitions. Uh, let's move on to the other one. It is an important part that we have to know all the terminologies of pharmacology. First of all, we should know what is a drug. Drug can be used for medicinal purposes as well as for non-medicinal purposes. As you all know, people are using drugs for abusive things and some other illegal things. Uh, Other than those things, drugs are really valuable for medicinal purposes to diagnose, prevent, relieve, cure all the mental and physical things. According to WHO, drug is a chemical substance that used to all those things. I have put the definition of WHO also in my slide. Besides drugs, there are a lot of terminology that you should be familiar with. Pharmacy. Pharmacy is health services. Disciplines apply the principles learned from pharmacology in clinical settings, whether it be compounding, dispensing of medicinal substances or clinical care. Pharmacist, as you all know, pharmacist is a chemist or druggist. Especially they are healthcare professionals who practice in the hospital or community pharmacy and are directly involved in patient care. They focus on safe, effective medication use by instructing and counseling patient on proper use. When it comes to the clinical pharmacists, they do more things by tracking adverse events and what are the interactions that can occur to the patient by using multiple drugs, some sort of things. Here it applies clinical pharmacy. Clinical pharmacy involves pharmacists providing patient care that optimizes medication therapy, management, and disease prevention. Actually, clinical pharmacy goes to the hospital care, especially when they do their job in clinic hospitals. Pharmacodynamics and pharmacokinetic is the main things that we are going to learn in pharmacology. Pharmacodynamic is the study of chemical and physiology effects of drugs and how a drug affects on organisms. In pharmacokinetics, we study about ADME. ADME means absorption, distribution, metabolism, and excretion. Toxicology is the scientific study of poisons. Poisons are substances that cause harmful, dangerous, or fatal effects. There are a lot of terminologies that we will be discussed in my channel further. I have mentioned here. Let's move on to the sources of drugs. There are 6 main sources of drugs: minerals, animal, synthetic, semi-synthetic, microbiological, plants, and recombinant DNA technology. Here, minerals means rocks. Uh, we can say as an example iron, iodine, and calcium are we are taken from mineral sources. Animal sources, that's a popular one, cod liver oil, and also the pancreatic insulins. But nowadays, pancreatic insulins are not much popular, but the beginning of insulin was there. Synthetic and semi-synthetic sources comes when chemical structure of a natural drug source is altered. We call it a synthetic drug. Most of the drugs used in recent times are man-made synthetic or semi-synthetic. As an example, we can say ampicillin. Uh, Microbiological sources are also used to prepare drugs. As an example, penicillium is used by microbiological sources. Plant sources. I have given there are three main plant sources: alkaloids. Uh, Actually, these are the things that extracted from plants: alkaloids, glycosides, and fixols. Alkaloids are basic substances containing cyclic nitrogen, which is insoluble in water but combined with acid to form well defined water soluble salts. We can give an example as cocaine. Glycoside is a ether like combinations of sugar with other organic structures. We can give an example of digoxin is a glycoside. Fixed oils are glycerides, esters of oleic, palmitic, and stearic acids. Their fats have a food value also. We can give olive oil simply. We use it for ENT problems. Olive oil is an example for fixed oil. There are many plant sources like volatile oils, mineral oils, resins, gums, tannins, lot of. Let's move on to the recombinant DNA technology. Here we are not going to talk about the actual mechanism of recombinant DNA technology, but yeah. Uh, let's move on to the drug nomenclature. Uh, Here we focus on three main things: chemical name of the drug, generic name of the drug, and proprietary name or the brand name of the drug. Chemical names is EPAC name. EPAC name most of you can learn from the chemistry, pharmaceutical chemistry. We learned about the EPAC name. As an example, N-hydroxyphenyl acetamide is the EPAC name for the commonly used pain reliever of paracetamol. I have given some example for you here. Sorry for the delay. We have some generic names as mebendazole that usually most of the people know as Warming, paracetamol, in Panadol, Ranitidine, Rantac. There are lots and lots. Here I'm going to finish my presentation. I will come back soon from more things. Thank you, and please subscribe my channel.